We are nonetheless confident that we shall overcome and bounce back even much stronger. Our resilience and character as a people and a nation have seen us overcome other calamities in the past. Fellow Kenyans, as we continue to battle this pandemic, the situation on the ground suggests that a lot more needs to be done by each and every one of us to flatten the infection curve. We have on several occasions made appeals to Kenyans on what they must do to achieve this. There is no magic bullet to beat the virus. The solution is to contain it and starve it of what nourishes it, which is spreading rapidly through human contact and physical closeness. The containment measures to flatten the curve remain the very basic ones of hand washing, maintaining social and physical distancing, wearing of masks when in public places, and discouraging public and private gatherings where physical distancing cannot be observed. Observing these measures surely causes discomfort and inconvenience, but they are the only known preventive measures that can be cheaply deployed to keep the virus at bay. This fight requires solidarity and steadfastness in keeping the course if we are to win it. Spotty and sporadic adherence to the measures by a section of society will certainly not help us achieve the desired results. We must all fight together, irrespective of our social standings in society. It is disturbing and disheartening to observe from time to time the casual manner in which some of us in leadership positions practice the containment measures. As leaders, it is of crucial importance that we walk the talk. We must lead by example. It does not help if we continue to appeal to our people to wear masks in public places, yet some of us as leaders do not do the same. And I want to appeal to all of us who are leaders and people that the citizens of this country look up to, that we must lead by example and work with the people in order for us to achieve the intended objective of being able to deal with this pandemic. As a government, the government has put in place all the necessary measures that it feels are important to be able to deal with this pandemic, including these measures, painful as they may be. We do know that these measures have worked in other places. They seem to be working in our settings, and we need to continue to maintain that. But the government can continue to do that, yet it needs the people to work with it, to cooperate with it, with the government, in ensuring that these measures are adhered to and that we will yield dividends from the inconvenience and the discomfort that we subject ourselves and sacrifices that we subject ourselves to for the purposes of the common good. The people of Kenya must play their part in this campaign. And their part is to cooperate and take responsibility also take responsibility, because we must be our brother's keepers. We must conduct ourselves, each and every one of us as Kenyans must conduct ourselves in a manner that we assume we are infected. Given that this disease has a large number of persons who may be carrying the virus but are unaware of it, the so-called asymptomatic people with who are asymptomatic for the disease. We need, therefore, to conduct ourselves as though we are carriers of this virus. And to do that, we need to, one, protect ourselves, and we also need to protect others. Hence all of these measures of social distancing, physical distancing, wearing your mask. The intention there is that everybody is protected. Even if you have done a COVID test and are negative, maybe 2 days ago, you may never know 2 days later whether you have contracted the disease, especially if you are asymptomatic. You may never know. So the point that I think we're trying to take forward here is that as much as the government continues to communicate to Kenyans on the importance of adhering to these measures, fellow Kenyans, please also take the responsibility of taking up these measures very seriously and doing whatever is necessary to protect yourself and protect others. Turning to our COVID-19 situation, we have today tested 2,959 samples. Out of this, 143 have tested positive, which brings the total caseload of confirmed cases in the country to 1,888. And the level of testing that we have conducted so far is 76,962 tests. All the 143 cases being reported today are Kenyans, of which 110 are males and 33 are females, with the age range from 1 month to 88 years. The distribution of the new cases by county is as follows. Nairobi County has 86 cases, Mombasa County 25, Uasin Gishu 11 cases, Kiambu 6, Busia 3, Kwale 3 cases, all from Sambweni, Migori 3 cases, all from Kuria West, Kajiado 1 case from Kajiado North, Kisii 1 case from Bobasi, Garissa 1 case from Lagdera, Isiolo 1 case from Merti, Kericho 1 case from Ainamoi, and Makueni 1 case from Kibwezi West. Kericho becomes the latest county to record a case, bringing the tally of counties affected so far to 33. By the distribution of cases by sub-counties, let's start with Nairobi. In Nairobi, Makadara has 45, Kibra 21, Embakasi South 6, Kasarani 5, Ruaraka 3, Westlands 2, Embakasi West 2, Langata 1, and Starehe 1. If we look at Mombasa, the 25 cases are from Likoni 11, Mvita 9, Jomvu 2, Nyali 2, and Changamwe 1. In Uasin Gishu, all the 11 cases recorded there are from truck drivers from Tarbo. The cases in Kiambu are from Kabete, 3, 1 each from Juja, Ruiru, and Kiamba. In Busia, the 3 cases are from Alupe Mandatory Quarantine Facility, 2 cases there, and Malaba point of entry, 1 case. We are glad to announce that today we have discharged 26 patients from various hospitals, patients who have fully recovered from COVID-19. This now brings our tally of discharges, recoveries and discharges to 464. And again, we want to extend our gratitude to our healthcare workers who continue to do a great job for our people. Sadly, however, we have also registered a loss of 1 male patient, aged 59 years, bringing the total number of fatalities to 63. We send our heartfelt condolences to the family and friends of the deceased. Finally, I want to thank the people of Kenya for being calm and understanding during this time when the containment restrictions have disrupted our everyday social and economic lifestyles that we have been accustomed to. But if we keep the course, and beat the virus, we can look forward to a day when we will come back to the norm that we have known. I thank you.
My name is Chumtai again from Citizen TV, and I have 2 questions. Do you have a criteria for when one has been tested, when the results are transmitted? Is it that those that return positive results are given priority? Because we know of a few people who were tested in Mathare 6 days ago, they've still not gotten results, whether positive or negative. So if there is a criteria for returning the results. And then the second one, possibly just give us the numbers regarding the informal settlements. How is the situation now? And just quickly, the issue of the political leaders having meetings. Some are done in the full glare of the cameras. Kenyans who are found in their houses congregating or put on quarantine, are there more stricter measures besides appealing to the political leaders to walk the talk? Are there maybe measures that will be taken on any other leader found congregating?
My name is Spirit Musel from KBC. I have 2 concerns on mental health and one on the discharge of Bishop Margaret Wanjiru this afternoon. He was saying that she was saying that she had food poisoning and diarrhea. These are the same symptoms she expressed before she went to the hospital and finally tested positive after 2 days. Are these additional symptoms of COVID-19 that we are not aware of? And number 2, on mental health, CISU have acknowledged that there are so many issues, especially at homes, following that most people have lost their jobs and also experiencing pay cut. But again, is there a way you can look into the issue of rent, because you have people right now at home with no way or means of paying their rent? Is there a way you can negotiate with landlords to either do away with the rent or reduce to some amount?
Thank you. Jina langu ni Wawero Nyambura kutoka Inoro TV. Swali langu kwa Bwana CS ni kuna lile swala la ubaguzi baina ya Wakenya. Kuna ile familia ya Kangema ambayo jana walizunguka na mwili wa mpendwa wao usiku kutwa na kisha wakaenda kumzika usiku wa manane na hawakupata nafasi ya kuona mpendwa wao. Ukilinganisha vile ambao hiyo familia ilikuwa treated na vile baadhi ya familia za vigogo hapa nchini wanakuwa treated, unauliza, je, sauti ya serikali ni ipi katika swala lao? Jambo la pili ni gavana wa kaunti ya Uasin Gishu amekuwa akisema kwamba kuna uwezekano hiyo serikali ianze kufanya kazi na madaktari wa tiba za asili kuona kana kwamba wataweza kusaidia katika vita ya COVID-19. Je, msimamo wa serikali ni upi? Na labda kwa Daktari Amoth, tukiangalia ile mambo ya projection, kwa sababu Wakenya ni kama wameanza kurudi life kama kawaida, projection yako wacha ya visa vya kila siku, vifo ni gani wakati hii grafu ya ugonjwa wa COVID-19 itakuwa katika peak? Asante.
Thank you, Mark Namasa from KTN News. I have a concern about mental health. There is a woman that I know of who has 2 children that have mental health issues. They cannot be admitted in hospital because the hospital is wary of introducing COVID-19 issues. But again, even when she's given over-the-counter medication, she cannot control her children in the house. They get out even during curfew hours. Has government thought about this population segment?
Okay. Thank you. Thank you. Let me start with Chemtai's question. You had several questions there. The first one was on criteria for returning results to those who have been tested. I believe we have already laid down protocol that dictates how and in what time frame, once results have been produced in the lab, that we need to be able to get back to those who have provided the sample. As you know, it's very important, particularly for positive cases, because once a case returns positive, it is very, very important, because the rapid response team will then have to spring into action so that they can be able to get to the individual who has tested positive, to be able to provide the necessary support in terms of containing that person, and also begin the process of contact tracing. So there is a protocol that actually does that, and people should get their results. One of the things that is done when people are being tested, whether it is the contact tracing or whether it is the voluntary testing, is that all these details are captured in a case information form, including the contacts, telephone numbers, and whatever is required to be able to get to that person. So it does work most times, but perhaps sometimes it doesn't work, and maybe that is why you see these delays. It could not work sometimes if there is an error in the information that is provided, or, as we have said repeatedly here, if those who are providing the information do not give the right information, contact information. We have talked about not being able to reach some of these individuals because when we call the numbers that have been given, we are not able to get them. So there may be some glitches here and there, but generally there is an established protocol, and the protocol has worked well for us, especially in being able to get, which is the greatest concern that we have, is being able to get to the positives very quickly. The situation in informal settlements, of course, continue to be of concern because of the nature of the informal settlement itself and the congestion in living conditions in these facilities. We have seen an increasing concern around Kibra. You have seen most of our numbers in the last in the last week or so have been coming out of Kibra, partly because we have also extended the testing, much more testing going on in some of these places. So I think as we go along, we are focusing upon particularly some of these informal settlements, so that we can be able to gauge and understand what the level of transmission is in these informal settings. Of course, if the numbers that we pick up in these settings continue to increase, a point will come when some intervention, it will be necessary to take some intervention to contain the spread of virus in these places. As with respect to the political leaders and what consequences they should bear, I think I would not want to respond on that, because we have other sectors that are implementing the measures, and I think we will leave it to those sectors to respond to that. Purity KBC, your question, the first question was regarding Bishop Wanjiru, who you say has tested positive, and I think your concern was the symptoms that she said she had. One of which was diarrhea. I didn't get the second symptom. diarrhea and
Food poisoning.
food poisoning. The food poisoning is not a symptom, it is a presumption that because I had food poisoning, I got diarrhea. But I can tell you, and Dr. Amot is here too, in fact, diarrhea is now one of those symptoms that COVID-19 causes. GIT problems, it does cause that. It's been established in all those countries where of course, the virus is around the globe. That's new information that is emerging now, that diarrhea is one of the symptoms that the disease can display as. The second question was regarding the condition, the mental stress that all of us are under right now, and particularly those who are more affected than others. Those whose livelihoods have been disrupted, who cannot make an earning, who cannot pay their rent and many other things. I think it is something that the government is looking very closely at. You have seen that His Excellency the President every time talks about this issue and talks about solutions on how to alleviate this burden upon particularly those who are disadvantaged. And I think the focus is there. Certainly the government as one will work to see how we can alleviate these problems that those who are, really disadvantaged in our society do not suffer that badly. That some form of relief needs to be provided to them. Waweru, wewe uliongea kwa Kiswahili ukauliza maswala. Umemuuliza ndugu yangu Dr. Amot kwa Kiswahili, nitamwacha kujibu hiyo swala yako ya upande wa ilikuwa swala ya projections projections ni ya Amot.
Nilikuwa na projection bwana daktari,
yeah.
Lakini pia nilikuwa na lile swali lako la Kangema.
Ndio, ulisema kuna ubaguzi kwa vile authorities wana handle wale watu wa chini na wale wakubwa. Nafikiri sio nia ya serikali kufanya hiyo. Kama inaonekana hivyo, sio nia ya serikali. Serikali watu wake wote ni moja kwao. Nasikia?
Basi serikali inaweza tuma apology kwa hiyo familia ya Kangema kwa sababu ya vile walizungushwa sana na hatimaye kufanyishwa mazishi wakati wa saa 8 za usiku. Kuna baadhi ya familia wanasema hata mama ya aliyekufa hakuhudhuria mazishi.
Wajua tuko katika wakati ngumu sana katika hii pandemic. Na unaijua hatari ya hii pandemic kwa upande wa inaweza kusambazwa rahisi sana, haswa kwenye mtu ambapo ameshafariki. Hiyo body handling yake ni muhimu sana, hiyo body ihandaliwe vizuri, na kuna protocol. Hizo protocol inaweza onekana ni protocol kali sana, lakini protocol imewekwa ili hiyo mwili ikazikwe kwa haraka. Ikazikwe kwa haraka. Manake ukiwacha hiyo mili ikae kwa nyumba, itakuwa ukisambaza hiyo virusi kwenye watu wale wako pale. Kwa hivyo hiyo protocol imewekwa na hiyo protocol inafuatwa. Kama inafuatwa kwa njia ambapo sio sawa, hiyo ni kitu kingine ambapo tunaweza kuiangalia tukajue zaidi ni nini imetokea katika hii kisa. Okay? Pia uliuliza swala upande wa governor wa Uasin Gishu, lakini sikuishika vizuri hiyo. Ulikuwa nini? Unaweza kuirudia? Okay. Dawa ya kienyeji maana. Unajua wakati kama hii tunaweza kujaribu chochote kuona vile kama inaweza kusaidia. Lakini dawa ya kienyeji pia kuna nidhamu vile unaweza kuitumia. Na kuangalia kwamba kama kweli ina manufaa ama haina. Kuna watu wengi wanaweza kusema tunazo dawa ambapo inaweza kupigana na hii COVID-19. Kuna wengine ambapo wanafikiria tu kutengeneza pesa kwa kuuza vitu zao, lakini si tukiwa wizara wa afya tunaifanya kazi kwa nidhamu, tunaiangalia kitu gani kweli ina manufaa na tunaweza kuitumia namna gani, na tuna encourage wale ambapo wanazo madawa ambapo labda inaweza kuwa na manufaa, tufanye na hawa kazi, tuangalie hizo dawa kweli kama inayo manufaa. Unakumbuka kuna madawa zingi, hii ya Madagascar umesikia inaitwa COVID organics pia, lakini hizi madawa lazima iangaliwe kwa utafiti safi, ifanywe kwa nidhamu, ijulikane kama hii dawa ina manufaa. Kama ina manufaa inaweza kutumika. Yeah. Na
and as has been reported here before, informal settlements are hotspots for transmission of COVID-19. And the cases that we have received so far from Kibera stand at 151. In Sili we had 121, and in Old Town we had 91. And that is why we are trying to focus more on the informal settlements, where sometimes it's practically difficult to ensure physical and social distancing. So our message there is more of infection prevention control measures and use of masks to be able to prevent aerosolization of the virus when we cough or sneeze or speak. Of course, the importance of provision of water and sanitation facilities in the informal settlements cannot be underestimated in this fight. Regarding the signs and symptoms of COVID, yes, each and every day we learn new things about COVID-19. As Waziri said, diarrhea and vomiting are now cardinal features of COVID-19 disease, especially in the elderly people and the young people, young children. And it is even postulated that there could be a degree of fecal-oral transmission, though this has not been confirmed. But on that plate also, it is important to note that the elderly also have a different presentation altogether. And many of the elderly people will present with lethargy. They also present with delirium, confusion, anxiety, depression. They can have unexplained strokes. Then there is also the loss of the sense of smell or anosmia, and loss of sense of taste. They can also get infection in the brain called meningoencephalitis, where the lining, the membranous lining of the brain is inflamed together with the brain tissue. Regarding the burials, we have standards and guidelines and protocols that we have developed and we have shared with our counties. And the standards, guidelines, and protocols are cognizant of our cultural practices. So as much as possible, once the body is properly prepared, then the risk is minimal. So there's no justification for doing a burial late in the night. Because once you double pack the body, put it in a coffin or a casket, and you are properly donned with personal protective equipment, then the risk of transmission of COVID to the healthcare workers and members of the family is minimal. Regarding the projections, our case fatality rate stands at 3.8%, and if we peak as the projections indicate in August at about 4,000 to 5,000 cases, then if you take 3.8% of that, it comes to about 160, 180 deaths. Regarding mental health, yes, mental health challenges are very, very apparent during COVID-19 pandemic because of isolation and social distancing, meaning that we don't get into close contact with our families and friends, and therefore there's that loss of the support that is a hallmark of African culture and behavior. What we are doing is that we have developed again standards, protocols and guidelines that we have shared with our counties, and we have also brought on board the community health volunteers who are our primary soldiers at the community level to be able to support individuals at the community level. Remember, the community health volunteers are appointed by the members of the community because they know they belong to that particular community. So for this particular case, I would really be interested in knowing where this matter was reported so that we can quickly get into contact with the relevant sub-county health management team to get to see how this family can be supported. Thank you.